Welcome to the HealthspanMD podcast. So welcome to the HealthsPan podcast, where we explore the science of longevity, and we focus on the three essentials for living a long and vital life: a strong body, a healthy brain, and what we call Medicine 3.0. That's the high-quality healthcare that's proactive, looking for opportunities to help you avoid disease. And today we have a very special guest joining us to talk about what I think is probably the essential of longevity that gets the least amount of attention, at least in traditional healthcare, but I think for most of us, and that is healthy brain. And to help us with that today, we have Pamela Brooks, a dedicated therapist who is passionate about guiding individuals through some of the most challenging transitions in life. So from navigating trauma, retirement, divorce, to coping with new medical diagnoses, Pamela is committed to helping people not just survive, but thrive. Her work aligns perfectly with our mission here at HealthspanMD to offer quality care that isn't just reactive, but also preventive, focusing on building resilience and healthy brains to ensure longevity. So in this episode, we're going to do a deep dive into some of the more challenging areas in longevity, like depression, anxiety, past trauma, and chronic pain. These are epidemic level problems without easy answers. But today we are going to talk with a real expert. Pamela Brooks is a licensed clinical social worker with vast experience. She practiced clinically under the guidance of Dr. Janine DeMarte and has spent the past 9 years in the transplant division at Mayo Clinic. I will tell you, I spent also 19 years at Mayo Clinic, and these are very challenging individuals with very challenging diagnoses. So she's had a lot of deep experience with people that are really at, challenging aspects of the times in life. And she's going to talk about some practical strategies for managing some of life's biggest challenges. So welcome to the HealthsPan podcast, Pamela.
Thank you so much for having me.
Oh, it's a real honor. We met at a recent event, and of course, we had that Mayo connection. But I think the thing that has really resonated with me, with you, is your deep passion for high quality care. Like, you just emanate that. Everything that you say about what you do and how you want to contribute that to the people that you see was really powerful to me. So let's start with talk. You talk on your website. You talk about working with adults who are striving to improve their quality of life. So let's talk about the challenging area of past trauma. I see this a lot, and probably it's present a lot more than when I actually see it. I don't actually bring it up with a lot of my patients, but I know that that's an underlying factor for many people. So how does unresolved trauma affect both mental and physical health, and what are the most common barriers to addressing it?
That is such an important question. Thank you for asking. So to quote one of the experts, Bessel van der Kolk, he states that trauma doesn't only impact what we think and how we think, but our very capacity to think. And I think that says it all. So it definitely impacts our cognitive abilities, but it also gets stuck in the body. Like his book that he writes, The Body Keeps Score. It is the cause for so much pain and underlying illness, such as autoimmune disorders, asthma, chronic pain, IBS, and so forth. And if you don't get help, then it literally stays with you. My best example is a 5-year-old girl I was privileged to work with back in community mental health. And she was having stomach pain all the time. She was unable to go to school in the morning without having a whole meltdown with grandma. And then when she got there, she would go to the nurse. So they brought her to me, only to realize that her tummy aches were all stress. It was all trauma. This poor child was in CPS custody and in her grandma's custody because of abuse and neglect. And if she didn't get help, if anyone in the future wouldn't get help with trauma, they have to live with those symptoms.
Yeah, this makes a lot of sense to me as a physician. We commonly see in cardiology people that have symptoms such as palpitations, of shortness of breath, of chest tightness. And, we do our testing, we'll do the echo and the stress test and the Holter monitor and all those things, and they all turn out normal. And that's reassuring for people. It tells them, okay, at least this isn't like early warning signs of what of something dangerous or something life-threatening. But there's also an unsatisfying part of that they walk away saying, okay, well, what is it? You told me what it isn't. And I've struggled with that, like I think most doctors do. And I'll tell them, well, medicine is really good at diagnosing, finding things that'll kill you and things we can treat. That's not everything, though. And, I wonder over time of 29 years of doing this as a physician, how many people that I said, oh, you're fine. And actually what the underlying driver was exactly what you're describing. Yeah. And, and probably a lot of them have diagnoses. I mean, one of the things about working at Mayo Clinic, I'm sure you've had this as well, is that, Mayo Clinic sees a lot of people that have been to a lot of doctors, a lot of facilities, a lot of institutions before without answers. And so, and the system is set up so they just keep going to the next doctor and getting a bunch of tests and then being told it's okay. And then the next doctor. How do people, if somebody that was maybe recognizes that in themselves. They say, you know what, I keep going to doctors and they're not giving me answers. They keep telling me my heart's fine. And they're starting to I wonder if something in the past, like I had trauma in the past that's affecting, me. How would that person know that? Like how would they start exploring if trauma is a factor in how they're feeling today?
So what I would look at is your functions of daily living. By the medical professionals, we call it your ADLs. To what extent are you unable to be present and like in a conversation right now when you go home to your family? Are you able to do your task at work? What does your sleep habits look like? Have they changed? Has your eating changed? Are you feeling muscle tension with no explanation? Like it's not because you went to the gym or you had an injury on the field. You have muscle tension, you have pain. You have a hard time sitting still. Even watching your favorite TV show, or now it's football season, unable to watch a football game when you normally love it. Are you feeling so worried and so anxious and so down that you aren't able to be around the people you love, do the things you love, or maybe have no motivation?
Boy, that's a really good description. And where do people start with that? I mean, obviously, the people who are going to listen to this podcast are going to say, hey, I need to go see Pamela Brooks about this. But in general, somebody who's been to their family doctor, they've been to their other specialist, they've had this evaluation, where would you guide them? Like, what would they do? Is there a website? Where would they go to that?
That's a great question. And I think, unfortunately, the stigma in society is so great, despite so many of our efforts to change that people are afraid to even say that they need help.
Yeah.
I know many doctors' offices have screening, so fortunately, maybe that can start the conversation. Or when they come to see you and there's nothing wrong medically, you can start that conversation. I know, like I am, and many people are on psychology today. But that could be daunting. I've looked on it just to network with colleagues, and there's so many people even within each person's zip code. And I always tell people, talk to your doctor, talk to your friends, talk to your clergy, talk to people who you trust, and see if they know anyone or themselves if they've had positive experiences. For example, when I was working community mental health, there was a school principal who happened to know me personally, and he would send people my way. They would have to request me when they got there, and that way he knew that he could trust me because he knew me personally. They trusted him. So I think a lot of times word of mouth or doing your own research is helpful.
Yeah, that makes a ton of sense. So I also want to talk about something else you mentioned on your website. It's prolonged exposure therapy. And this just intuitively feels right to me. I can think about a billion things in my past where I'm like, ugh, that really was terrible the first time I did it. But the more I did it, I got more comfortable with it. We were just talking about giving talks. At one time that was terrifying to me. Now I've done it so many times that I don't, you really even break a sweat to go up there and do it. Can you explain how prolonged exposure therapy works and why it's important for someone to face their trauma rather than avoiding it?
So, and explain how it works. I'll also explain why it's so important to do. So imagine you don't face a trauma. You are feeling anxious all the time. You're unafraid to do things. You don't do the things that you would have normally done. So for example, I worked with this girl, a college student. She was assaulted sexually, harassed for a long period of time. She stopped going out with her friends. A college girl who was always a straight A student started to fail. She couldn't wear normal fitting clothing. She couldn't wear makeup. She couldn't wear her hair down. She started to isolate. And she even said her coloring was off comparing pictures before and after working with me. So I always start with a piece of education. You know, this part showing people, look at where you are right now. Is this somewhere you're comfortable?
Yeah.
Because exposure therapy isn't comfortable, let's be honest.
Yeah.
I don't think anyone wants to do exposure therapy, but it's effective. What we do with prolonged exposure is I start off with the education. Education is critical, explaining to them why we're doing it, which is to beat the trauma down. Imagine you're like in a box and you can't get out because you're afraid. You have all these thoughts in your head that are telling you it's not safe to go to that restaurant. All these people will say certain things about you if you wear your hair down, if you wear that dress, if you're happy smiling with your friends. You're not capable of studying because all these thoughts are intruding your mind. It's taking you from who you are. So essentially you're trapped in a box.
Yeah.
And prolonged exposure gets her out of that box. What we do in our sessions is we look at each other just like we are now, except your eyes would be closed, and you would tell me the story of your trauma. You record it. And then your imaginal exposure piece at home is you listen to it. Each and every day you listen to it between sessions. And over the course of time, by listening to it and then talking about it with me and then recording yourself again with me, we decrease your subjective units of distress. Then there's the in vivo part, and that is you actually doing things. So for the example of this particular client, you know, first she would open her closet and look at the dresses. She wouldn't touch them, wouldn't wear them. Then eventually she was trying them on at home. Then eventually she was do the same thing with her hair and makeup. And then by the time we finished, she was able to do all that and go out to dinner with her friends in a popular, trendy area. Right now, I'm so proud to say she's actually studying abroad. Wow.
Wow, what a powerful story. And I think one that resonates with probably all of us. Like we to varying degrees have some leaning towards comfort. I personally, I would say I have an addiction to comfort. Like I'm like, oh yeah, that's uncomfortable. I don't want to do that. And then, but I also have through conditioning realized that often the things that are most uncomfortable for me are the most important things that I need to do.
1,000%. The way I think of those symptoms, you know, people are living with them. Either way, this may feel more uncomfortable at first, but then you really break through that trauma. It's the most incredible thing to watch, at least as an outsider, as I watch my clients go through that.
Yeah, that's a really good point. Weighing that, you know, just saying, okay, it's uncomfortable either way. Which discomfort are you going to choose? The empowering one or the disempowering one?
Exactly. An analogy that I was taught, it's like, imagine, like for example, I don't like swimming unless it's 100 degrees outside. So, you know, you make me put my feet in when it's 80. It's not going to feel good. Yeah. But if you keep doing it over time, it's going to get easier.
Yeah.
And then you get to celebrate your victory. And for this girl, she's really celebrating. She's studying a new culture and a new language, something she could have never done when we started almost a year ago.
Yeah, that's so powerful. That's really cool. Is this something, I mean, I can only imagine as a non-mental health professional that somebody describing their story, like telling the story of their trauma, that can bring up a lot of emotions. I mean, a lot of things. This sounds like something that probably should be done in the setting of a professional, like with professional guidance. Would you agree?
I would completely agree, because the challenge is, let's say, you know, I think back to my years of sleepaway camp and youth group, and we'd have these sleepovers and you're all together and you tell this scary thing that happened or this embarrassing story. You tell it once, and then you're left with all those symptoms heightened. Mm-hmm. In this thing, you are safe. In this protocol, you are safe. You're talking with me one-on-one in a confidential environment. And then instead of just telling me the story once, you tell it to me and then you listen to it. And then you come back and you tell it again. And each time your subjective units of distress are at a higher level, we take that and continuously break that down. So it's the repetition that you're habituating yourself to hearing and talking about your trauma.
How, that brings up when you talked about, this has to be a really intimate relationship between you as a therapist and the patient. They're likely sharing things with you that they've either not shared or that they've not shared with very many people. How do you break through that? Because I can imagine somebody coming and saying, okay, my life's pretty terrible now. And then you do a deeper dive, but they're not ready to tell you. Okay, well, because it's embarrassing maybe. Maybe they've done something that they're just like, they can't even admit to themselves, or, it's something that's happened to them that they've taken blame for, that they're ashamed of, and that they shouldn't be. How do you break through that? Like, how do you get them to trust you to share?
The first part really is the psychoeducation and rapport building. I explain to them the significance of what they're doing and how important it is to do the therapy, not necessarily this or with me, but share with them why working through the trauma is so critical. I teach them lots of coping skills. So we're giving them an explanation as to what they will be doing, why it will be helpful. And you know what? It's going to be hard. So let me teach you a whole set of tools for your toolbox. So we go through breathing, multiple breathing exercises. I've taken a course in trauma-informed yoga, so I utilize that with every single client, no matter what. We do different grounding exercises. We do relaxations. So they have these like on speed dial, so to speak, for themselves that they can pull out, never during the exposure because they have to get used to being uncomfortable.
Right.
But they can finish the exposure in our office and they can complete relaxation when we're done. So by the time they walk out, by the time they close their telehealth screen, they feel ready to go because they had that relaxation. And a part of it is just the way maybe you have patients who come in. I can only imagine how scary it is to be diagnosed with anything on a cardiac matter. And part of that, it's getting to know them, taking interest in their lives and showing them that you care. They're not just a number to me.
Yeah. I can imagine how powerful that therapeutic relationship is, and freeing people to share, the things that are really driving their low quality of life, frankly. One thing when we first started this, we talked about that, the impact of trauma, how it can show up with, and get diagnosed with multiple things, autoimmune diseases and all these different aspects. But one thing that is really an epidemic is chronic pain. Chronic pain is something that is, so common in my practice. I don't know what the percentage is, but I don't know, 25, 40%. I don't know. People have, some degree of chronic pain, and medicine has done a terrible job of treating chronic pain. I mean, the opioid epidemic is just the most stark example of how poorly we've managed this. And things have gotten better since then. Like, thank goodness we're not just, passing out OxyContin like candy anymore. But I can only imagine that the underlying driver of a lot of that chronic pain may be the past trauma for them. Tell us a little bit about your experience in those people, like how common chronic pain is, and whether there's hope for people that have that issue.
So I've happened to work with quite a few people who do have chronic pain, and the people I've worked with also have underlying traumas. I'm not sure if it's a coincidence. I'm not sure exactly why, what came first, the chicken or the egg. This was from my work, and especially in behavioral health group homes, and also when I was going to long-term care facilities. So I saw quite a bit of that. And in my experience, I think about how, what their lifestyle was looking like and what we can do to approach it in a healthier way.
Yeah. Is this, so somebody, the usual way somebody has chronic pain, they go and see their primary care doctor. Primary care doctor may refer them to a specialist. to look for an organic cause of that chronic pain. Let's say it's abdominal pain. You're a young girl example earlier. Well, they're going to get a lot of GI tests, gastroenterology tests. If they're an adult, they may get an EGD, colonoscopy, X-ray, CT scans, all of those things, and those all come back normal, and we don't have an explanation for them. Yet they still have the symptoms. When should somebody that has been in and had all the evaluations, and there's no organic cause, and they trust their doctors, they've done a good job, when do they start exploring other things? Is it okay, now I need to see a pain specialist for medications and injections, or when do they say, you know what, maybe I need to see a mental health professional?
So going back to the same thing as your activities of daily living, how much is it impacting you? Mm-hmm. Because when they do see a therapist, we take an entirely different approach. And that's why it's such a great combination. I always tell people, get everything looked at medically first before you come to see me, because I would hate to miss something, because I'm not physically touching my patients. I'm not doing any scopes or exams. But if they're coming to me with pain, I like to reassure them that there's hope, that there are techniques that work well.
That makes a ton of sense. So if your issue is your right knee is, bothering you, that's that's you're staying with the medical professionals, pain specialists, all those things. If it's your right knee is killing you, but also your quality of life is poor and you're not engaging in things that you enjoy, and there's other things that are going along with it, that's when, a mental health professional may be the next step.
Exactly. Because again, if you're quote unquote working through the pain and your life is fine and your emotions are fine, you have this sore knee, that's one thing. But from a cognitive behavioral aspect, there's so much that a therapist is able to do that maybe a traditional doctor wasn't trained in.
Yeah, that's and I can imagine also, or I've seen it, frankly, people that have chronic pain not explained by anything that we can assess medically. That's got to wear on you as well. Like maybe the chicken or the egg, as you said, maybe it was the chronic pain that led to the mental issues. Maybe it was the other way around. But in the end, maybe it doesn't matter as much because the mental health issues still need to be addressed.
Exactly. Like, for example, I'm thinking of two different clients. One of them, he has two medical diagnoses that do impact every aspect of his day. So I wonder, like, hypothetically, if he was your patient, you could say, yes, he has this cardiac diagnosis, and this is pretty severe. However, the more stressed he is, the worse it is. And then the worse it is, the more stressed he is. So we have this cycle when it comes to, a medical illness that it's chronic and it's always going to be there. When you think of pain as well, there's ways that we can look at it through CBT for pain.
So you brought up CBT a couple of times, cognitive behavioral therapy. I'm going to share something with you that I think was really interesting, and I just want to get your thoughts. One, CBT makes so much sense to me because we all have faulty thought patterns, right? Like I have things where I make assumptions of things that were wrong, and it led me down a bad path. But one of the most common cardiac problems we deal with is atrial fibrillation. It's a heart rhythm problem. Usually the heart rate goes fast and irregular. Some people don't have any problem. They don't have any symptoms of it even when they're in it. For other people, it makes them miserable. But what's really striking to me as a cardiologist is that when people get atrial fibrillation, and often it's an off and on thing, how that impacts the quality of life. Like it's not uncommon for people to say, well, I used to love to travel, but I'm afraid to be on a plane and have this come up. I used to love to go visit my grandkids, but now what if this happened during? And so they get more and more isolated, and they're really struggling with their quality of life. This was a study where they did CBT, and it was a pretty limited number of sessions of CBT, like 3 or 4 or something like that, in people who they described as symptom preoccupied, which I thought was a nice term.
Mm-hmm. That's actually perfect.
Is it? Yeah, and the outcome benefits, and I won't quote them because I don't remember I haven't read the paper in a while, but it was something like a 50% reduction in emergency room visits, and this huge improvement in quality of life. And I'm like, for a corporate medicine driven world where everything seems to be, balanced on the dollar, avoiding ER visits for AFib patients, there's a big return, a financial return, not just, hey, it's the right thing to do and people are going to be happier. That actually could save dollars as well. Does that, in your experience with CBT, does that make sense to you? Like, is that something?
100%.
Yeah.
It's same thing with like others. Yeah, with CBT, I'm thinking like for the CBT for sleep, for example, the results are the same as medication, except when you get off the medication, you lose everything. Whereas when you stop the actual treatment for CBTI, for insomnia, for example, you still have all those skills. So CBT for pain, you are learning skills cognitively, how to think about things, how to reframe, how to stop and reframe automatic negative thoughts.
Yeah, so we do CBT for insomnia in our practice. Maggie Thayer is our physician assistant. She's had 10 years experience in psychiatry, and she's used that tool, and it's so cool. Like, it wasn't that long ago where anybody's, I'm struggling with sleep. Oh, here's your Ambien. Right?
Exactly.
We just shove that out to them. Well, now we have research data that shows that you take Ambien, mortality's higher. Like, it actually, people don't live as long that take Ambien versus who don't. Like, these medicines, and we all have experiences, or at least all medical professionals have experiences of people that the Ambien is a disaster for them, like puts them in really dangerous situations.
So that's exactly why I'm so passionate about what I do with CBT.
Yeah.
Why? Because we are trying to break the cycle. When you're trying, we do break the cycle.
Yeah.
When you're in pain, you want to isolate. You don't want to do the things that you would normally do. You don't want to be around like the grandchildren that he would normally be around.
Right.
And additionally, then when you feel badly, you do less. And then because of all that, physically and emotionally, you feel worse, and it just continues. So we try to have different strategies, such as we'll do pacing, which is you'll pace an activity. Like maybe they play with their grandchildren for 5 minutes, because at the 7-minute mark, they're going to be in pain and out for the next day. Maybe they walk, even if it's just up and down the driveway with their grandchildren. And that's what they do each, when they're visiting, and they practice to do that each day when they're at home. Obviously, anything from a physical standpoint, we would always collaborate with a doctor.
Yeah, one other thing I'll say about CBT that I like explaining to a patient of mine who says, I'm really struggling with my sleep, and I say, cognitive behavioral therapy, and sometimes the pushback will be, I don't want to be in like therapy forever, type of thing, and I'm like, nope. That's not CBT. Like, in this is you 2 or 3 or 4 or 5 sessions. Like it's something that's really goal oriented, not a, hey, I have you in therapy, so now I need to meet with you for 3 hours, 4 times a week for the rest of your life. Like that, it's really, at least from my patient standpoints, they like that idea. They like the idea that there's an end in this. Like they can really see some results early on from that.
Exactly. I completely agree, because instead of just doing stuff in the session, I always say the real work is what happens when you turn off your screen. The real work is, are you pacing? Are you recording that? Are you walking? Are you doing pleasurable activities? Are you practicing relaxation? And are you catching your automatic negative thoughts? See, they don't need me every week to do that. They don't need me forever to do that. In fact, I was taught as a therapist that our job is to get rid of our clients. Our job is to put ourselves out of a job.
Yeah.
That's how we know we're doing well.
Yeah. Well, that's the way I think about things from a learning perspective. If I listen to a podcast, read a book, and I feel like I've learned something, but I didn't change my behavior. I mean, I didn't change anything about what I'm doing. I didn't learn anything. It wasn't valuable. It's when I can take something and put it into action. That's when I've learned something. And you're educating people. But that's one of the things in medicine that I think we've missed the boat on a little bit. A lot of times, at least in the traditional medicine, we think what people are missing is education. We say, if we just tell them, hey, if you don't start eating better, you're going to die. Well, they're gonna pick that up and run with it. They already know that. They don't need the education. It's the reminders, and I think from a therapy standpoint, you can help them with the what, but where your real value is, the cool thing you do is the how. Like, how do you implement this?
Exactly. And I love how you asked that question, because I always tell people, and again, I've worked with, from the person in the long-term care facility who is not able to work, to the judges, to the attorneys. And these people, I say, okay, I know you're smart. I see what you do for a living. I know you're capable. The question is, what is the barrier? What's going to stop you from between right now when you turn off your screen to when I see you, let's say next Wednesday at 12, what is going to stop you? So I put a lot of energy into I would say some of the smartest people I've ever met on the barriers, because there may be nothing actually stopping them from doing it than themselves. Yeah. So exploring that, and the rapport you were speaking about earlier, that's where that really fits in. I just have this image right now of a client I worked with. I see his face walking in, and you could tell he was embarrassed to tell me, sorry, Pam, I told you I was an exercise every day, and I didn't make it on the Peloton every day this week. And it's that rapport that they want to do well for them, but also they want to share with you how they're progressing. So you build that relationship in which they want to do better.
This is one of the foundational stories of why I practice medicine the way I do. I've told this a couple of times, but at Mayo Clinic, I had created the Heart Health and Performance Program, and it's their prevention program. And I was seeing this guy. I was pretty excited about it. I mean, everybody saw a dietitian. They saw an exercise physiologist. They saw me. We did all this testing. People loved it. It was really great feedback. But there was this one guy who was a wildly successful CEO, like an international company, like wildly crazy, busy life. He was successful in everything that he did, but his health was a mess. Like he was, check the boxes: pre-diabetes, high risk for heart disease, high calcium score, high blood pressure, drank too much, didn't exercise, high stress, didn't sleep, all these things. And I would see him every 3 months, and it was like Groundhog Day. I'm like, okay, if you lose some weight, eat less, move more, because that's where I was at that time. But since you didn't, here's some more medicines. Here's an adjustment. And along the way, I got to where I didn't look forward to our visits, because I'm like, well, I'm not helping him. This is a waste of time. But at one of our visits, about 18 months in, he says, I wish I could see you every 2 weeks. And it took me off guard. I was like, well, why would you want to see me every 2 weeks? Because it's a waste of time. And he said, because when I see you, I'm on it. Like I'm engaged. I know this is important, and I'll stick with it for a week or maybe 2, but then life gets busy and I get distracted. And next thing I know, it's 3 months later and I'm embarrassed, but I know I have to come in and face the music and see you and tell you I didn't do any of the things that you said. And he's like, there's got to be a program that can help me stay on track. He even said, this is Mayo Clinic, for God's sake. There's got to be a program. And I'm like, there's no program like that. I mean, there's go join Weight Watchers, or, get a gym or whatever. And he's like, yeah, I've tried those. They didn't work. They're not my doctor. And I realized then is like, that's our opportunity that we've dropped. You much less so, because you recognize this in your training, is that we have that opportunity to help our patients with the how, actually execute the things that they yes, education, yes, we can do those things, but it's that jump from what to how that is missed a lot of times. And that you do so well. One thing I really want to do a deep dive in, I ask everybody about this, it seems, and most people give me a blank look when I talk about resilience. But the reason I'm so interested in resilience is that I've realized in a longevity practice, the people that are resilient, like if you wanted to describe one thing, like, okay, well, what's the one thing that's going to be the best predictor of longevity? I think I would say resilience. I mean, I have patients who have faced like just challenge after challenge after challenge, and they're just going strong. Like they just keep up. But I also have hundreds of examples of patients who, as life went along, they just kept taking losses, right? They lost some health issues. They've lost some independence. They lost a spouse. They lost a friend. And those losses pile up to the point where you walk into the room and they're done. Like they're just not able to bounce back anymore. But I also, believe that resilience is something that we can train in people, and also build in people. Give me your take as an expert in this. Like, how do you see resilience in your patients and then in your practice and maybe even in your personal life?
So I always start again with education, and coping skills are so critical. The way you would prescribe, a certain medication as a preventative measure at times, or maybe you or other doctors would say, get your flu shot, take your vitamins, take your daily vitamins to prevent XYZ later on to create longevity. So I joke, they're like your mental health gummies, right? So you need to do coping skills on a daily basis. A personal example is, even if when I don't want to wake up at 5 or 6 a.m., I go to the gym. Because for me, that's a habit. So the how is you do it. Sometimes I've been told by my mentor, sometimes you fake it till you make it. Do I really want to be getting up? It's dark outside. At times it's freezing outside in Arizona at 5 a.m., but I'm going to feel better because I worked out today. So those coping skills, for some people, is sipping your tea, enjoying the fresh air. For others, it could be writing in a journal. Specific clinical skills that we teach are different: relaxation, breathing, grounding, and mindfulness. Those are all things I do in sessions. Then you think about yourself, the way you look at yourself, because everything is going to come at you, right? Sometimes it's early retirement. The example of working with this amazing man who was a veteran. He also did a lot of DOD work, and he was the patriarch of the family. And when he retired, it was as if, he was like persona non grata all of a sudden when he finally had all the time to give everyone. And he had all these automatic negative thoughts about himself. So you work with him and other people who've had these challenges, and you create a rubric for yourself, because life isn't going to stop. Those challenges, yes, they continue to build. A client who we thought the divorce was his obstacle, only to find out he calls me a year later for more help because now the ex-wife's completely out of the picture. So he's doing everything on his own, a hardworking father. Mm. And then you think of someone like talking about transplant, people go on dialysis, and they can turn the dialysis into quality family time. People will, come visit them at the centers.
Boy, that resonates with me so much. I will say, really impactful to me. Well, I'll tell a personal story and then an observation. When you talked about building those habits, I remember specifically the day that I committed to exercising every day, and it was during my first year of fellowship. I'd been up all night the night before on call, and I said, you know what, I'm too tired to go exercise. I have all the excuses in the world not to do it, but I knew I had this history of I'd start, I'd stop, I'd start, I'd stop. And so that day I said, okay, all I'm going to do is run around the block. Like if it was 7 minutes, I'm probably exaggerating. Like it wasn't long at all. But I felt so much better that day. Like, for some reason going through, like meeting my commitment, my identity as a healthy person, actually sticking to that felt so good that I just don't miss days anymore. Of course I miss days. There's things that come up, but boy, it's rare. And when I miss them, I'm like, I can't wait to get back. So then I worked out because I had to. Now I like try to keep me from it because I'm not the world's, like I'm not out there doing HIIT every day and running marathons, but I'm moving. And I'll say that was the best mental health thing that I ever, intervention that I ever put for myself. The other observation from what you said, the retirement thing, I saw this so much at Mayo Clinic that it scared me to death, is that these colleagues of mine, high-performing individuals. I mean, they were so sought after. They were the leading lights, nationally recognized, giving talks, accolades, all these things, and then boom, retirement. And they get the little letter saying, we'd like to thank Dr. So-and-so for their tireless activity for 30 years while we replace him with somebody else and say goodbye. And then there'd be a little party and we'd all have cake. And then I would see those people afterwards, and the change in them was like so dramatic. It scared me to think, what am I going to do in that? I'm guessing you deal with people with those kind of transitions on a regular basis, and you describe kind of how that approach. Tell me somebody, if you were pre-shadowing somebody. Hey, you know what? I'm a busy person. I'm going to go into retirement, into a new diagnosis, into a new relationship. I know there's going to be a lot of, transition here. What are the things that you might tell them beforehand that might help that make it
So the
easier?
first thing is the coping skills. Again, I probably sound like a broken record. I know my kids get sick of hearing it, but doing things to take care of yourself. So you're at your best self when these changes come. You want to stay, according to Daniel Siegel, you want to think about your window of tolerance. Your window of tolerance. You want to do as much as you can to stay in there. But again, all this is coming at you. All this life transition, the stuff you maybe didn't ask for is coming at you, and you want to be prepared for it. So it's like putting on your armor. Like the gym for you or me, it's putting on our armor before the day starts, so we're already
I like
calmer.
that a lot. Yeah, that's a great analogy.
And then a colleague of mine taught me, actually this summer I learned, is that you create a rubric for yourself, like your own checklist of who am I? Because yes, you are an amazing doctor, but you're more than just a doctor. You have other things in your life. So think about, your values. What do you hold close to you? That doesn't just stay in that box of your professional life, but other things. And then you grade yourself on how did I handle that? How did my character, my personality traits, how did I handle that situation? Because if you're living true to yourself, regardless of the painful, procedure, the challenge of waking up and realize, oh, I don't have a job today, you're grading yourself based on your character, not on what everyone else is looking at you or thinking of. A few other examples when I think of retirement, like using that same man who's a veteran. He now lives in a smaller town. So what he's able to do is he created a club, like a Jeep club, for example, or other clubs that, different things, without saying too much, that would improve the quality of his community's life, but really improving his life. Another example, I love the very first place I worked with in mental health, our Dr. Bayless, he happened to have close friends who were professional athletes. And at his funeral, some professional athletes thanked him for combat golf because he helped them get through their transition. Another example I think of, a woman, my grandmother actually, who I highly, highly admire. She's the reason why my sisters and I, we all have post-college degrees and the grandsons don't. So we always joke at that, is she kept herself so busy when she retired, so busy that she volunteered for museums and on committees that I joked she was more busy retired than she was. So it's about, again, going back to your rubric. What are your passions? What are your hobbies? Who are the people in your life you care about? Because if you hold on to who you are through all this, you remember you have an identity besides being a doctor.
Yeah.
Or yesterday I had the privilege of watching a baseball game with one of the moms, and her husband's a former baseball player, but that's not his identity. He has so much more in his life that he's worked on and cultivated, like a beautiful family.
Yeah. Wow. Yeah, that's so good. I want to start wrapping things up. I do want to go back to one of the things you said in the beginning about the stigma of mental health. And it's certainly gotten a lot better from when I was younger, but still to this day, it's a huge issue. And it's a huge issue among physicians. Frankly, among physicians, the reality is any physician who acknowledges any mental health challenges is at risk of losing their profession still. Like that's a fact. So that stigma, part of it is, societal and regulatory, but a lot of it is, so I would say more often these days it's in our own head. We're afraid of being judged by others. But others would probably be a lot more gentle on us than we are ourselves. What would you say to somebody, that's hesitant to they say, oh, you know what? I really do think this is an issue for me. Probably therapy would be a right thing for me, but either fear or stigma, they're just afraid to take that first step. What advice would you have for somebody like that?
The first thing I would say is if they feel comfortable telling anybody, maybe talking to their doctor, maybe a family member, a clergy member, because I can understand, the stigma is so terrible these days. even now it's better than it used to be. I'd say it's still bad. And seeking help, so speaking out, but finding if there's anyone in their life that they trust. And then asking them, again, going through their network, who do you know? Who have you heard of? Who have you seen things about? So they feel comfortable that they're going to a safe person. Just this afternoon, I was talking to a family member, and they were saying, I know somebody who needs some help. Who would you send them to? And I said, I'd have to think about it. I don't want to just refer anyone to anyone. I think, would I send my family member there? So I put a lot of energy into investing into relationships with different providers. So that way, when someone comes to me, depending on what the issue is, I at least have a direction to point them in. And going back to the stigma that you mentioned. So about 5 years ago now, I was in New York visiting a friend. And it just rolled off her tongue, oh, Pam, there's my therapist office. And she happens to be a teacher. And I just loved how for her, maybe it's where she lives in New York, it was so normalized. And just drawing to attention that you and so many other physicians work so hard. I actually have a sister who is a surgical resident. And every time I call her, how are you? Are you taking care of yourself? Because I know other people are not asking those questions.
Yeah, that's, and I guess from my perspective, medicine is you just suck it up and tough it out type profession, right? Like that's our training. We went through, residency and fellowship and, on call, up all night. Oh, and then worked a full day the next day. Like that's just expected type of things. But one of my biggest mentor, Dr. Appleton, he was, the smartest cardiologist I ever met, just a brilliant guy. He was the chair. He hired me at Mayo Clinic. But one day he just said, you know what? We all need some help at some point in our lives with our mental health. Like we all need that outside perspective. We all need that assistance. And it just seemed like such a brave thing for him to say, but it strikes me now how somebody I really admired saying, yeah, this is reality. This is okay. It's not like, okay, get up, rub a little dirt in it and move on, right? It was acknowledging. And, even more important these days, like the data, the numbers on how many people are dealing with anxiety, depression, post-traumatic stress disorder, trauma, all these things. I mean, it's just overwhelming. One article said 40% of adolescent girls have anxiety disorder. Like, I don't know how accurate that is, but it was in the Journal of American Medical Association. Like, these are striking things, and it seems like that world is set up to escalate those things. So I guess I really appreciate you taking the time to share with us your expertise. I know a lot of people got a lot of value out of this. Can you tell us, our audience, how can they connect with you? If they wanted to potentially see you as a patient or they wanted to learn more about you, how would they connect?
So I have a website, brookscounselingaz.com. I also have my number on there, my email on there. And for those who are worried about confidentiality, which everyone in this world is these days, it's HIPAA compliant. So they can reach out to me, leave me a message, leave me an email. Those are probably the best ways.
Great. Well, Pamela, thank you so much. It was a real pleasure having you on the podcast.
Thank you so much.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low quality healthcare, schedule an appointment at HealthspanMD to experience healthcare as it should be.